Hi everybody, it's Amy at Elemental Health again. Today popping in to talk about men's mental health and reasons why they might not, or they might not want to seek help. I've got a crying cat behind me, please ignore that. So first things first, getting a GP appointment is very challenging for a lot of people. It may involve you getting up really early to sit in a queue with like 27,000 people only to then run out of time and have to nip to work or do the school run or whatever it may be, or you just run out of patience. Secondly, actually attending the appointment, once you pluck up the courage to do so, if you do, then actually getting one that's in a reasonable time frame can be very difficult as well. If you see a doctor, and by the way, this is no like slate or rant at the GPs, they do not have the time to spend with people, which is something I'm sure that most of them would love to do. But if you do get to see a GP and you come away with a prescription, it's then filling that prescription. So do you go to a local chemist where they know you? Is that going to embarrass you? Do you feel worried about the stigma maybe of being on antidepressants? Just popping a pill, happy pills? Maybe you're worried about the side effects. One of the most common side effects of antidepressants is loss or lack of libido. So really affects your sex drive. For males, it can really affect your ability to get and maintain an erection and to ejaculate. So that could be another reason why you don't want to take them. Associated weight gain. Other side effects like just not quite feeling yourself, feeling quite meh, not up, not down, just kind of in the middle. No real happiness or joy, just surviving, not actually enjoying any aspect of your life. Even things that might have brought you a lot of pleasure or joy beforehand just become tedious and just another job. And then of course, you can be on them for some time. You may be suggested that you come off them, or you change them, or you reduce the dose. So it may be that you think, I don't want to live on these anymore, this is not doing anything for me, and you decide to come off them, and then you find, oh, actually it's not that easy. It's difficult, and it leads to a lot of problems for people, including things like suicide attempts, which is just dreadful. But I understand, because I've been there. Not with a suicide attempt, but you know, a lot of very dark moments. You don't have to do it on your own. I'm here to tell you, if you're nodding going, oh my god, yeah, I totally hear what you're saying, Amy, let me just revisit and let you know again, my name's Amy Abbott. I'm a neuroscience nurse. I'm also an ex-army combat medical technician, and I have left the NHS now and founded and set up a company called Elemental Health with my husband, who is still in the NHS. He's a psychiatrist, but he's a former neurosurgeon. We set this up because when I was really ill, about a decade ago now, I was just being offered more and more medication to combat the side effects of the other medication, more and more benzos, more and more things like propanolol to slow your heart rate down, to stop the panic attacks. I spent thousands on supplements. I was researching all the time. What CBD? What about this? This one says it's better than that one. Is it really worth 75 quid? I don't know. Until I just thought, balls, there's got to be a better way than this, because this is absolutely shite. This is not how I want to live. I'm just existing, surviving the day, drinking too much alcohol. Honestly, I could never envisage a day where I felt better, and I never in a million years thought I'd be in the position I'm in now, and that is just 9 short years, although it's not felt like short at all. I also have qualified in an aspect of psychotherapy to help you find the answers. So what do I need you to do? I need you to connect with me. Drop me an email. I'll put my email in the comments. Give me a like, give me a follow, DM me, voice note me, whatever you need to do, just reach out. The at-home mood reset pathway, I've literally just signed a man off today who's just completed his 12 weeks, who's gone from being severely depressed to being mild, who's literally cried over Zoom and said, Amy, I never thought I could be like this. It's only been 12 weeks. And just a reminder that in 12 weeks, if you'd sought traditional treatment like medication, you might just be starting to get a bit of a result if you're stuck on the same one, providing that works for you, which invariably people have to swap and change and try different ones. It's 3 short months. There's a few spaces left before Christmas. It's an amazing present for somebody who is struggling with anxiety and low mood or depression. If you're already on medication, this has been shown, the pathway itself has been shown to complement your antidepressant therapy and to enhance it. So it might mean that you're always going to be on the medication, and that's fine. There's no issue with that. Maybe you just don't want to increase your dose. And this is a good chance will allow you to stay where you are, maybe combat some of the side effects. Maybe you want help to wean down. Maybe you want to come off them and you're like, I just don't know where to start. I don't know what to do. Reach out, because I do know what to do and I will help you to come off them. You're not on your own, fellas. And unfortunately there is still stigma around. Absolutely, you know, all this is okay to not be okay. There's still a lot of stigma. Man up, get on with it, crack on. You know, you're a man for God's sake, you're a husband, you're a father, you're a partner, you're a business owner, you're a top level exec, you're a CEO. You shouldn't be feeling like this. What right do you have to feel like this? Because, you know, you've got a roof over your head, you've got a family, you've got everything you could possibly want. So why do I deserve to feel like this? There's people so much worse off than me. Sound familiar? All this internal chitter chatter. Truth is, it doesn't matter what your circumstances are, what your situation is. Mental health is not, it's not picky. Very, very high profile people, men particularly, Tyson Fury for one. Tyson Fury's been very open about his struggles with mental health and has done loads for male mental health and for encouraging people to come forward. It doesn't discriminate, but you don't have to feel stuck. So please, 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 if you're struggling, drop me a line and get in touch. Take care now. Bye.